NSAIDs and female athletes don't mix. Safe and effective integrative options for pain relief for active women. Hi, I'm Jessica Drummond from the Integrative Women's Health Institute, and I'm here to bring you a training specifically for women's health, sports, and orthopedic physical therapists, health coaches, fitness professionals, nutrition professionals, and any other health or wellness professionals who work with female athletes. So let's jump right in. Welcome. So what we're going to cover today is why NSAIDs, non-steroidal anti-inflammatory drugs, things like ibuprofen, Advil, Motrin, Aleve, why are these NSAIDs so damaging, especially for female athletes? They're damaging for all athletes, but why in particular am I focusing on them in women athletes? We're also going to talk about how to screen your female athlete clients for resilience using a number of different screening and health history tools. We're also going to be discussing evidence-based and cutting-edge functional nutrition strategies to reduce pain in active women. We're going to be talking about how to use health coaching strategies and skills to augment pain science education for active women. So pain science is a very hot topic for physical therapists, and I want to kind of bring together physical therapists, health educators with coaches and health coaches who really understand the science of behavior change. And as we combine pain education with behavior change strategies, then we get such better results in our clients actually implementing the strategies that can help them to reduce pain in the long term and stay active and competing in the long term, stay in their sports, remain as athletes if that's what they so want to do. So let's have some fun. At the end of this webinar today, I have a special invitation for you. So I encourage you to stay until the end. I'm going to keep it a surprise until then. And I ask that you eliminate distractions. I know we live in a distracted world, but I have turned off and put away my cell phone. My children are being well taken care of in other rooms, and one of them is actually away from the house. So I suggest that you do the same thing so you get the most out of this training today. I suggest that you close all of the other windows on your computer, you silence your cell phone notifications, and find a quiet place so that we can focus on what we're going to be discussing and learning today. So, first of all, to introduce myself to those of you who don't know me, my name is Jessica Drummond, and I started my life almost from the very beginning as an athlete. I was a competitive gymnast beginning at the age of 7, and I actually started doing gymnastics when I was 3 years old. My mom, like many moms, brought me to the YMCA. It was close to our house where I grew up. As a child, I lived in Stamford, Connecticut, and I'm sure she probably needed something to do with me. At that time, my younger brother was not yet born, but I'm sure my little sister was in some activity. And, it was near her house, and she dropped me off at the gymnastics class. And from there, I spent essentially 13, 14 years of my life in gyms in Connecticut and Virginia, and competing all over the country. At my peak, I was a level 9 gymnast and considered doing collegiate gymnastics, but actually decided to become a collegiate cheerleader, which actually wasn't my original intention when I went to college. But one of my roommates, freshman year of college, wanted to be a cheerleader, tried out for cheerleading, and so she dragged me along. And I actually became a cheerleader. For some reason, she decided not to do it. I don't remember the whole story now, but it was a lot of fun. I really enjoyed it. We cheered for University of Virginia, basketball and football, and, NCAA tournaments, ACC tournaments, which was a lot of fun. Then when I went to graduate school, when you go to physical therapy school, there is a lot of peer pressure to be really athletic. And so while I always worked out and I always went to the gym, that's what got me running. So I did 5K races with my grad school friends, and I ran the Peachtree in Georgia, the 10K a couple times in Atlanta, and running really wasn't my sport, but I did it because of all the physical therapy student peer pressure. And then I became a physical therapist. I graduated from graduate school in 1999. I started my career in orthopedics. And pretty soon after doing orthopedics and sports, I specialized a few years into my practice. So I had a lot of training in manual therapy, and I worked with a lot of patients who were athletes, but also weekend warriors, post-surgical patients, all kinds of orthopedic injuries. I worked in a sports medicine clinic, but I also worked in a level 1 trauma center. So saw a lot and had a lot of great mentoring from other wonderful manual therapists those years. But my real love came when I started working with pregnant women with orthopedic injuries, with women who had completed breast cancer surgery and treatment and had shoulder injuries. And for about the next decade, I specialized in women's health physical therapy, which was primarily looking at pelvic pain, pelvic health conditions, pain and other challenges related to pregnancy, birth injuries, incontinence, bowel and bladder issues, breast cancer, and other women's cancer issues, an inpatient and an outpatient perspective. So I spent a lot of time really hands-on with women in all different kinds of hospital and outpatient settings who were recovering from injuries that were related to sports and sometimes looked like sports injuries, but were not at all related to sports, were related to surgeries or birth experiences, or even auto accidents. I remember one patient who had a car accident in the midst of her pregnancy, a pelvic fracture. So that was a really fragile injury that we had to deal with, and it worked out well. But then I had a baby, and after years of, teaching mom and baby exercise, I had my own little baby to bring to the class, and I had been working a lot. I'd been moving a lot. My husband's job moved us quite a bit. I had a baby, and about 3 years after she was born, I really hit a wall of burnout and was diagnosed with adrenal fatigue, which we don't really call that anymore. It's sort of an outdated term. But really what that means is that my stress response system, the stress response system piece of my endocrine system, otherwise known as the hypothalamic pituitary adrenal axis, really was in dysfunction. It was maladapted to my high stress life, which, having been kind of a type A go-getter since I was 3, I didn't see my life as being particularly high stress. But when I took a step back from it, I realized how high stressed it was. That led me down a path to finding functional medicine, to find my own sources of healing. So I went back to school. I got a certification in clinical nutrition. I'm now in a doctoral program for clinical nutrition. And about 5 years ago, I founded the Integrative Women's Health Institute. So my whole life and my whole professional life has revolved around working with women, working with active women, working with injured women, working with burned out women. And so I have a very personal relationship with the female athlete population. Unfortunately, that beautiful black and white picture of that gymnast is not me. I'm the other one. All right, so let's jump into the content now that you know my story and how I came to become an expert in female athlete nutrition and wellness, because I really had a lot of the experiences that my clients now come to me having. Now as a woman in my early 40s, I want to keep being active. I love to exercise, but I have to be much more mindful about the kinds of exercise I do. And I have to be mindful about how I take care of the little aches and pains that can often come along with exercise and pushing ourselves in sport, because, women over 40 are among the fastest growing group of competitive athletes at the local level, swimmers, runners, triathletes. And so they are going to be coming into your professional clinic and your wellness practice with joint aches and pain, with muscle ache and pain. And so the first line of defense from kind of the allopathic medical model is to simply use nonsteroidal anti-inflammatory drugs to tamp down that pain. But there are some significant consequences if we take Advil like candy and use it with our daily aches and pains, starting in our teen years or even middle school years, all the way through collegiate athletics and into our, midlife and beyond. So first of all, taking NSAIDs may actually delay healing of the musculoskeletal system that we're trying to support the healing of. There's conflicting data, but NSAIDs may actually delay tendon healing, and it depends on the studies that you look at. But in one study, there was seen if a person who had a flexor tendon repair was given high dose ibuprofen, so 2,400 milligrams a day for a month, they actually did see some improvements in the range of motion of the repaired finger joints. However, I'm starting to ask, well, at what cost to the gut? Because we know that NSAIDs actually worsen intestinal permeability, which can set women up for autoimmune issues, and, just digestive problems, nutrient absorption problems. So that high dose of NSAIDs over that period of time doesn't come without risks, even if it does help the healing of that tendon. However, in animal model data, NSAIDs negatively impacted tendon healing depending on the timing of the medication. So in the animal models, using NSAIDs from day 11 to 20 impacted healing more negatively than using them for just the first 10 days. So there may be a occasional short-term place for the use of NSAIDs, but not as something that we want to do continuously for our athletes that are continuously struggling with joint aches and pains. Additionally, we have good data that shows that NSAIDs can delay fracture healing and actually impair ossification, impair the healing of bones when people actually have stress fractures or other bone fractures. NSAIDs for women, and this is one of the reasons why I'm so passionate about this for my female athlete clients, NSAIDs can temporarily inhibit ovulation, which is a huge problem for our female athlete clients who are trying to get pregnant in their 20s, 30s, and 40s, and who may already be coming into the game with a history of menstrual irregularities or other fertility risk factors. So NSAIDs can add a fertility risk factor. NSAIDs absolutely damage the intestinal lining. And the more we start to understand about the essential nature of having a healthy gut microbiome. In fact, just yesterday, I read a fascinating study that patients in the ICU with lung disease have a problem with their intestinal microbiota, and the gut bacteria is actually in the lungs for some reason. So healthy gut bacteria and healthy intestinal lining is probably two of the most important foundations that anyone can have for their general health. So we know that NSAIDs damage the intestinal lining. Virtually all studies agree that all conventional NSAIDs increase intestinal permeability in the human within 24 hours of ingestion. So it's not just this high dose NSAIDs for a long period of time. And this is equally evident when they are taken for a long term. So let's come back to our female athletes. If using NSAIDs like candy is not the answer because of the significant risks, there are also cardiovascular risks to taking NSAIDs. What are our other options for helping our female athletes continue to be at the highest levels of performance that they want to reach, pushing the limits in their sport, enjoying being fit and active all through their lives? What do we need to start out by screening for in these athletes? Well, we really have to consider their whole health. We need to consider digestive health, immune health, nervous system health, endocrine health, and the health of their musculoskeletal system. So I use 3 assessment tools pretty regularly in my practice. I use the functional medicine timeline to get a complete history and document a complete history of my client. I use the functional medicine matrix to look at where is everything functioning and where are there little areas of dysfunction, both at the biochemical and cellular level or the structural level, and in her life in general. And we'll talk about that in a moment. And I use the tool we developed in the health coaching program that I teach here at the Integrative Women's Health Institute, the holistic women's health assessment, because each woman is not her injury. She is a whole person. So we'll talk about how I use these in a case study in a few minutes. But, when we are coming from the perspective of functional medicine, we are thinking about a client's whole life history. So was she breastfed? Was her mother under a significant amount of stress when she was pregnant? Was she born vaginally or by C-section? I just mentioned how essential a healthy gut microbiome is. And the more we're learning about that, and a baby, so that your client's gut microbiome began to be established at birth and slightly before, but mostly at birth. And if she was a C-section baby, her gut microbiome may not be as robust as if she was vaginal delivery. And again, it also depends on her mom's health. It depends on if she was breastfed. It depends on her early food. It depends on everything, whether she had a dog or not, right? We want to also look at, was she, sickly throughout her life? Was she a really early competitive athlete who had lots of stress fractures or lots of ear infections or lots of colds and flus or menstrual irregularities, starting in her tween and teen years? So we need to look at the history when we're thinking about the patient that's standing in front of us and what she brings to the table in terms of resilience through her whole life. We also want to consider each system from a more biochemical and physiologic aspect. So things like defense and repair. Is her immune system strong, or does she get sick all the time? Does she have food sensitivities? Her structural integrity. Has she had a lot of orthopedic injuries during her life as an athlete? Has she had fractures and sprains? And, has she had multiple surgeries? And when we talk about things like assimilation, is she able to well absorb nutrients, or has she been taking NSAIDs like candy for decades and she has a really irritated intestinal lining or an increased permeability in her intestinal lining? But not only that, but is she assimilating into her life now? Maybe she just moved. Maybe she's on a new sports team. Maybe she has a new coach. Maybe she got a recent divorce. So there are issues involving all of these systems that are very cellular, and there are issues in all of these systems that are very macro and have to do a lot more with her lifestyle than her physiology. So we look at each whole person. Antecedents are things like history, or things like, she maybe had a birth issue or was very sick as a child or had menstrual irregularities, in her early teens. The trigger is something that has triggered this particular issue that you're looking at with this client or patient in the moment. And mediators are things that may be maintaining the problem. She continues to work at a very high stress job, or she continues to perform in a sport that really drains her emotionally, or she continues to eat a really poor diet. And how is her lifestyle? Is she getting good quality sleep? How is her exercise feel nourishing and invigorating, or does it feel depleting and punishing? What kind of nutrition plan is she on? Is it nutrient dense? Does she have food sensitivities? Is her food inflaming her? Is she under a lot of stress, either having to do with her sport or other life stressors? Maybe she's a collegiate athlete and she's struggling with her academics. And how are her relationships with her coach, with her family, and so forth? And then from a whole woman perspective, is she full? Does she have a positive perspective on her health, on her recovery, on her life? Is she have a positive perspective regarding connection, good support networks, great friends, supportive family, supportive healthcare team? How full is her nourishment, or is she restricting, trying to lose weight, worried about body image issues? How physically strong does she feel? What kinds of resilience does she have when it comes to strength in other areas? Does she have financial resources, supportive family and friends, emotional strength. So we really look at all of these categories very holistically, and I'll get into more specifics in a moment. When I look at this assessment tool with my patients, I say to them, our resilience is only as strong, only as rich as our poorest domain. So we can't neglect any of these areas over time. So from a physiologic perspective, to really screen, there's some helpful testing when we're talking about a woman who's presenting with acute or chronic pain. We want to see what's her organic acids test looking like? Is she nutrient depleted in any area? A SpectraCell test will also show that. Organic acids also shows more a potential for systemic yeast issues or digestive dysbiosis. So certainly when the gut microbiome is out of balance, that is a huge problem related to pain. The Dutch hormone test can give us a lot of information around how are her melatonin levels, her sex hormone levels, her stress hormone levels, because when the hormones, I would say, interact with or communicate with the nervous system can be more susceptible to interpreting less intense signals or less potentially dangerous signals as more intense pain. So ultimately, the system who's the decider about whether a woman has pain or not, to steal a term from George Bush just briefly, the deciding system is the nervous system. So a person can have a fairly significant injury and not feel very much pain at all. And on the other hand, a person can have very minimal tissue damage and can feel significant pain. And the deciding factor is the nervous system, but other systems communicate with the nervous system to make the nervous system more or less sensitive to having pain no matter what the tissue damage situation is. And the endocrine or hormone system is certainly one of those systems. Then we think about the thyroid, and we want a pretty in-depth panel of the thyroid, because the thyroid does, when it is out of balance, it communicates so closely with the rest of the stress response system, it can thus have an impact also on nervous system sensitivity. Certainly, we want to be looking at digestive function, intestinal permeability, the microbiome in the stool, small intestine bacterial overgrowth is something certainly to screen for, and that is an overgrowth of bacteria in the small intestine, where most of them should be living in the colon or large intestine. And certainly, genetics can be interpreted via increasingly available software. And this is very cutting edge, but more and more available. So I'm going to show you one study specifically related to athletes. And I think we need to start looking at this in the new era of personalized medicine. So let's talk about we've talked about some screening tools. Now, what are we going to be looking for with these screening tools to help to take a whole body approach to reducing pain in our female athletes without having to use damaging medications? So, as I mentioned, the age of personalized medicine is on the horizon. Our patients and clients will have increasing access to medical lab and genetic testing without physician orders. We must begin to understand the clinical relevance of these tests, and sometimes there's very little understood clinical relevance. We also have to know when that's the case, and how to apply these tests to the populations that we serve. So, for example, in a pilot study of 14 male and female collegiate triathletes from Stanford University, the researchers created a database of genetic SNPs, so these are genetic variations, that each had some degree of evidence supporting their application to common athletic injuries. So this is what you're going to be seeing more and more. Databases that help to interpret genetic data by pulling in the published data into a software system that we can use more readily clinically. Each athlete had his or her genes sequenced through 23andme.com, and then they uploaded this data into the database that the researchers created. And there were some different injuries that were included. This study focused on specific SNPs relevant to collegiate athletes. So they were looking for risk for Achilles tendon rupture, ACL rupture, bone mineral density issues, osteoarthritis, vitamin and mineral deficiencies, or sickle cell trait. The researchers created the database based on analysis of the available published literature and issued each student athlete a report. And they found variabilities of risk. So in this report, the red is high risk, green is low risk, yellow is modest risk. I don't remember what the gray is for, but this patient, as an example, had decreased risk for elevated homocysteine, which is good for long-term cardiovascular risk, but an increased risk for an Achilles tendinopathy might be one of those kind of irritating, chronic, soft tissue injuries where an athlete, a collegiate triathlete, might be taking a lot of NSAIDs for this. Also, she had increased risk for vitamin D deficiency, which certainly low vitamin D can impact the nervous system's interpretation of signals that could lead to more pain when we've got a nutrient deficiency like this, and also low calcium levels, which may make it difficult for bone healing if there is a fracture, and so forth. So the students were then counseled on risk reduction strategies based on their individual results. So once they saw this, their clinicians can then give them lifestyle medicine, nutrition strategies for improving bone mineral density by taking multivitamins or specific vitamins and minerals, specific exercise recommendations, specific sunlight exposure recommendations. And for the women in this study, their injuries the following year reduced by 50% compared with the year prior to the study. So if you know you're at risk for Achilles tendinopathy and you take specific preventative measures, nutrition, lifestyle medicine, exercise, stretching, whatever, they found that they didn't need to pop these NSAIDs because they actually prevented the injuries by 50% compared to the year before. Overall, this study yielded positive results in terms of injury reduction. The athletes tended to be motivated to follow the specific nutrition and exercise recommendations because they had these specific reports that were kind of triggering that motivation. And they often chose to share the data with their coaches, doctors, and families. Now, certainly there are ethical challenges. There are lots of tangential discussions we could have regarding genetic data, but I think this is a fascinating study to point out here because as we can more specifically and in a more personalized manner begin to implement prevention, lifestyle medicine, and nutrition and exercise programs, there is going to be less need for these Band-Aid medical fixes that do have side effects because we'll be preventing the injuries outright in a way that's very motivating to athletes in this study. So when we think about, okay, what are our strategies? Well, certainly there are key supplemental nutrients and herbs for female athletes. However, before we get into what those are, in each individual case, you have to look at each case as a personalized individual case. What is that client? What is that patient's dietary foundation? As I always say, you cannot exercise and you cannot supplement your way out of a bad diet. So here's one study that looked at high-level athletes, 67 rhythmic gymnasts. They were on average about 18 years old, high performance level, training nearly 40 hours a week, over 36 hours per week. 60% of these women had already menstruated, but the age of menarche was delayed to an average of about 15 years old. And all 100% of the subjects here revealed, 100% of these 67 gymnasts revealed menstrual irregularities. And as a side note, a study from 2013 that looked at a wide variety of NCAA collegiate athletes found that only 9% were getting even enough calories, never mind micronutrients, to maintain healthy menstrual cycles and to maintain general health for the amount of intense exercise they were putting out. A study in Australia a couple of years earlier of very high-level Olympic athletes, same problem. Only about 60% were even getting adequate calories. And, anything from a range of about 20 to 50% of those athletes, when they looked deeper, they found very significant micronutrient deficiencies. So they weren't getting enough, folic acid and iron and calcium. So our highest level athletes of all ages are not getting enough nutrition. You need to support this intense exercise with very specific personalized nutrition programs. So the average BMI of this population of gymnasts was 17.4, which is low. Body fat was only just over 9% on average, which is very low for a woman. They had low total calorie intake, low intake of multiple B vitamins, vitamin D, vitamin E, vitamin K, and quite a few minerals. So we know that macronutrients are the proteins, fats, carbohydrates, and calorie deficiencies are common in female athletes, even in other sports like soccer, which are not as known for body image issues as, gymnastics and diving, and ice skating, ballet. And where, sometimes there is encouragement within the sport to eat energy reducing diets. So to be quote unquote dieting. And the problem was, even in this soccer population where there were, the women that they were looking at, the athletes in this study were female soccer players. So they weren't really dealing with as much body image challenge. They weren't really dealing with as much of a pressure to be thin, other than, of course, the intense societal pressure to be thin that rests on essentially every woman in the Western world. But even those athletes, so it's not just these kind of the sports that we usually think of, it's even those athletes that are not under as intense pressure to be thin still are showing up with macronutrient and calorie deficits. And, when they ask them, about their diet, the things listed as the main dislikes were vegetables and fish. And in the population of soccer players, the specific micronutrient deficiencies that have been studied in some of these other sports are not even very well understood at this point. But at the end of the day, if you have intensely exercising female soccer players not eating enough calories and not really enjoying vegetables and fish, you can be essentially assured that they are struggling with nutrient deficiencies. And we do see this across the board. Certainly in gymnastics, you've got more common problems with nutrient deficiencies and calorie deficiencies, but you have this in middle distance runners, long distance runners. It's a problem across a variety of sports. Even in, when we're talking about micronutrient deficiencies, vitamin and mineral deficiencies, this is an issue across genders and across sports in a wide variety of countries. So what are the micronutrients that we want to be certain that our athlete clients are getting at least a minimal baseline amount of? So the branched chain amino acids are essential because they can reduce inflammation and increase the expression of genes involved in the antioxidant defense, including superoxide dismutase, catalase, and glutathione peroxidase 1. For athletes who are injured or overtrained, which is a lot of who we're seeing in our clinical practices, adding branched chain amino acid supplementation can support recovery. Omega-3s and creatine are also essential. A recent rodent study demonstrated that fish oil supplementation may reduce the impact of immobilization on muscle atrophy. So if, a woman, has a fracture and she's immobilized and she's walking around on crutches, taking creatine did not attenuate muscle loss, but in the legs, but muscle loss was seemed to be minimized in arms, in arm muscles that were immobilized, and those animal models were given creatine. So that may be beneficial. And I believe I didn't discuss the omega-3 fatty acids here, but also omega-3 fatty acid supplementation does support healthier muscle once those casts come off. So supplementation with creatine and omega-3 fatty acids is important if you are working with an athlete who has a very specific injury that needs to be immobilized. Now, calcium, vitamin D, and vitamin K during healing from fractures is essential for optimal bone healing. And we know that our athletes are not just kind of getting it through their diet unless it's being emphasized, because we have so much data that these general diets are inadequate. The recommended daily intake of calcium for female athletes who are children and adolescents is 1,300 milligrams per day. But current intakes are only averaging, they're averaging between 500 and 1,600. So there are some who are getting adequate calcium intake. But again, we have to think in that personalized medicine mindset, because many, many, many athletes are getting much, much less. And ideally, this is one of those micronutrients that our clients want to be getting from primarily food sources, because calcium supplementation carries some cardiovascular risks, especially if it's not balanced with other minerals such as magnesium. Estrogen is also essential for bone health in premenopausal female athletes, both because it can slow bone resorption and can actually stimulate its formation. Female athletes who are having these menstrual irregularities have an increased rate of osteopenia and fracture. So that's a huge red flag when we've got young women having stress fractures. Also, some herbal supplements that support the health of the endocrine and hormone system, such as chaste vitex, can actually help with bone recovery. So in this study, there were 64 women aged 20 to 45 years old. They had just had ORIF surgery, and they were randomized to several different groups. In one group, they were given chaste vitex plus magnesium. And then another group 2 was given just the chaste vitex. Group 3 was given just magnesium, and group 4 was given just a placebo. Treatment with the combination of the chaste vitex and the magnesium supplementation enhanced the serum concentration of osteogenic and angiogenic factors and increased callus formation during fracture healing. But interestingly, the only change in serum concentration of osteocalcin was observed to be statistically significant. So the mechanism is not yet very well understood, but we do know that the combination of chaste vitex and magnesium, maybe it's through a hormonal mechanism, maybe it's through a more direct nutrient supplementation mechanism, does help with bone fracture healing after a significant surgery. Now, there were some limitations to this study: a small sample size, high numbers of patients lost to follow-up. So this is preliminary data, but important to keep in mind if you're working with lots of female athletes who have fractures, especially those who also have hormonal challenges, hormonal dysregulations. And compared with compared with white men, all women, and in particular minority women, are at higher risk for deficiencies of vitamin D3. So again, this population needs to be assessed even more closely. So, and again, D3 is essential for reducing the impacts of injury in female athletes. So in this study, 14 recreational athletes performed intense exercise on one leg, and then the other leg served as the control. Vitamin D concentrations inversely predicted muscular weakness in the control leg, Immediately, muscular weakness in general, that control leg versus the exercise leg peak force, immediately and for days after exercise. So higher vitamin D levels before exercise may reduce post-exercise weakness for several days, up to 3 days in this study. Vitamin D is essential for bone health because its effect on calcium absorption. Calcium absorption is approximately 10 to 15% in the vitamin D deficient state and above 30% when serum vitamin D concentrations is at least 30 nanograms per milliliter. So really depleted levels of calcium and vitamin D are much, much worse than even low sufficient levels. But if we get our athletes up into the optimal ranges, it's even better. There's almost a 50% reduction in the incidence of stress fractures in girls who participated in a high impact activity in the highest quintile of vitamin D intake. So if girls that are up in those optimal ranges of vitamin D have almost a 50% reduction in stress fracture risk. And this is really important because up to 20% of all injuries treated in sports medicine clinics are stress fractures, and women have stress fractures at a greater rate than men and boys. 9% of female military recruits versus just 3% of male military recruits, nearly 10% of female athletes compared with just over 6% of male athletes. So anytime one of your clients presents with a stress fracture, even if you are not, the primary clinician involved there, you want to be screening her from your perspective for what we call relative energy deficiency in sports. It's an expanded term that expands upon the definition of the female athlete triad for many reasons. Number one, it's not always just women. We're talking about women today in this lecture, but this is not always just women. And it encompasses more than just fracture, eating disorder, and menstrual irregularities. That was the original definition of female athlete triad. We're now seeing that there are cardiovascular effects, there are mental health effects, there are effects on performance, there are effects to the bone, there are effects to the hormone system that are not just transient, that can be long-term and lifelong. So a detailed medical history is essential in any girl that presents with a stress fracture, including her dietary practices, her weight fluctuations, her energy intake. Is she getting enough calories? Is she getting enough nutrition? What's her micronutrient intake? Her menstrual history, her current menstrual status, her BMI. Is she having any signs of bradycardia or orthostatic hypotension? I would also suggest asking about her sleep, asking about how much joy she's having with her sport, asking her about her support network, how much pressure she's under to perform in her sport or to perform at school or to perform at work. We have to look at the whole woman. How much does she love her sport, or is she just sick of it at this point? In a study examining male Finnish military recruits, found vitamin D status to be a significant determinant of max peak bone mass. So don't forget, girls have this opportunity to build up peak bone mass until about their early 20s, and that's it. If they don't do it, and we see this in men, but it's just as important in women, if they don't do it, if they're not getting enough vitamin D in that critical time when they have to build peak bone mass in their tweens, teens, early 20s, they are going to be at higher risk for stress fractures or any fractures in the longer term. So when we look at what is that more optimal level, you can go too high. We don't want to hit above 125 for sure, because there can be toxicity risks, and anything below 30, we're really looking at a significant deficiency that has to be dealt with. But we really want to be closer to 40 or 50, maybe even slightly higher. That's where we're in that more optimal range, where we're really lowering long-term risk for stress fracture. Finally, we also want to talk about another category of nutrients that is essential in this population, that is antioxidants. So Physical exercise causes oxidative stress, and this is a good thing. Essentially, you're causing a minor kind of controlled stress on the body so that the body systems are triggered to respond to that and become more robust. Exercise accelerates the rate of oxidative metabolism, which increases the reduction of reactive oxidative species. Oxidative stress is the imbalance between the generation of ROS and the antioxidant defense capacity of the body. Some oxidative stress is, as I said, valuable to system resilience in the female athlete. The problem is when it tips too far out of balance. So not all oxidative stress is bad. It also plays an important role in the regulation of signaling processes, secondary messengers. These ROS, these reactive oxidative species, are secondary messengers that control a variety of physiologic functions. And endogenous ROS generated by the cells may function actually as survival and repair signals. So we're putting a little bit of stress to kind of amp up this system to become stronger and more resilient. But in any particular athlete that you're dealing with in your practice, you want to be looking for, does this specific athlete have sufficient antioxidant availability? That's why that organic acids testing or spectra cell testing can be so informative. If your athlete is already depleted in antioxidants, adding the oxidative stress of exercise may not be appropriate at that time. Additionally, we've got to make sure she's just got enough of all of the essential vitamins and minerals. So when we're looking at organic acids testing, we're looking for antioxidants, but including something like vitamin C. But vitamin C is also essential for synthesis of collagen. So if there is a soft tissue injury, ligament, joint injury, there's no clear evidence of the necessity of high-dose micronutrient intakes during injury recovery, but we have to keep in mind that unless you've done this screening in sort of a pre-sports or a yearly sports screening session, we don't know if that athlete is coming in with micronutrient deficiencies. And if you look at the generalized data that I presented a little bit earlier, it's almost 100% assured, it's like 91% assured that she's presenting with some micronutrient deficiencies. And you can look at a 3-day food journal and just see if she's really taking in enough micronutrients. And in most cases, the data shows the answer is no. So once we've screened for all of those different issues, including the most common micronutrient deficiencies when our client is presenting, because those deficiencies are essential to restore for the sake of prevention of pain. When we are lacking in nutrients, the body doesn't have all of the key ingredients that it needs to run the neurologic system biochemical process, the immune system biochemical processes, the metabolism and detoxification system biochemical processes. We need all of these raw materials. So assuming we've got a strong foundation of nutrition now, maybe filled in some micronutrient deficiencies with supplementation, we also have to talk about what really is pain when we're explaining it to our athletic clients. We don't want them to ignore pain because pain can be a useful signal for reminding us that it's time to have some restorative time. Maybe they are overtraining. Maybe they've pushed too hard. Maybe they're on the cusp of injury. Maybe it's the wrong time in their menstrual cycle to be pushing this hard. So the key ingredient of pain science that I think it's really helpful for all of our clients to understand when they're struggling with any kind of acute or chronic pain is that the nervous system is the interpretation center of whether something is going to be painful or not. And it's not a very specific or reliable system. But if we reduce the hyper-responsiveness of the nervous system to nociceptive input or even non-nociceptive input. So we used to think that these nociceptors, these quote-unquote pain receptors, triggered pain. But we now know that nociceptor, do not necessarily trigger pain. You can have a significant injury, significant stimulation of nociceptors and not have a lot of pain. And you can have very little stimulation of nociceptors and have a lot of pain. So it's not a direct one-to-one system. Instead, we have to be using our health coaching and health education skills to talk to female athletes about how to keep the nervous system from essentially overreacting and triggering a pain response, which really can be interpreted as a fear of danger response. So if that athlete fears that something is injured and that's going to cause some danger, maybe she won't be able to compete, maybe it's a really bad injury and she'll have long-term consequences. When fear, chronic inflammation, a hopeless perspective, an overlay of depression, feelings and fear of no hope for recovery, dependence on medication or even dependence on therapists, medical professionals, other therapies for relief, and a lack of support can all upregulate, can all kind of make the nervous system hyper responsive to any even relatively minor pain trigger because the nervous system is concerned that there is a serious danger. So I highly recommend a book called Explain Pain by Laura Murren Mosley to get a real handle on the fact that if we can, as clinicians and as wellness professionals, really encourage an environment of safety, support, reduced inflammation, and quieting of the nervous system, nice health of fluid flow, nice relaxation of muscles, an environment of safety within that client or patient's body and within her environment and the people around her, the likelihood that her pain will be extreme and or unrelenting or long-term or become chronic or stay chronic is very much reduced. So things that can help induce that safety in the nervous system sensation are optimism, our nervous system calming. So things like meditation and breath work, self-care, exercise, nutrition, sleep, having a brilliant support network, eating an anti-inflammatory diet, which may for each woman be different. Some women are very sensitive to oxalates. Some women are very sensitive to grains. Some women are very sensitive to sugar. Some women have sensitivities to gluten or soy or dairy. And, some are sensitive to meat and do better in a vegan environment. So it's highly individualized and we have to be respectful of that. Herbs are very anti-inflammatory and can be helpful. Exposure to nature is anti-inflammatory and can be helpful. So all of these categories of things help contribute to an environment where pain is less intense, less chronic, and even less likely. So health coaching can augment this pain science by helping each individual client or patient to set a vision for her recovery goals, to set a vision for her life goals and her health goals and her performance goals. And then we coach that client to take baby steps to reach her particular goals. As coaches, we hold athletes accountable to her goals, not her coach's goals, not her mother's goals, not her teammates' goals, her goals. We bring awareness to her values and her values conflicts. Maybe she really is feeling fatigued and is ready to take a break from her sport, but she's inches away from getting a college scholarship and she needs that funding to go to college. There are some real essential values conflicts that we need to address to help women optimize their health in an environment of pressure. Health coaches provide a safe space for non-judgmental mindful listening and communication, respect for the intuition and innate healing wisdom of each individual woman. And we support those without serious mental health challenges to be challenged by pushing them out of their comfort zones a bit to reach for their goals, not the goals of others. And we support our clients as health coaches to learn to build resources, webs of support, physical resilience, and emotional resilience. Resources are so many things. If we broaden the idea of resources and we help women to accept and receive those resources, they really can do so much more with that support and have their body feel more safe, which does reduce pain. And let me talk about a quick study that I'm going to get to a case in a few moments here. But we have some interesting data in a population of collegiate athletes that using these health coaching type skills under a cognitive behavioral stress management program really does impact the health of these athletes. So the components of this cognitive behavioral program provided a rationale for behavior change. So at the core, health coaches are experts in behavior change. And I believe that every clinician, every nutritionist, every physical therapist, every physician, every occupational therapist, every nurse, every clinician should have health coaching skills, because we always need to be communicating with our clients in a way that supports healthy behavior change. We almost never sort of do the thing to the client that gets them well. They get themselves well in an environment of support. So using these interventions, we explain the physiological and behavioral effects of stress. So that's where clients first are just really educated. These female athletes have to understand what is the benefit of stress, what is the negative of stress, how does stress function in the body, what is the impact on the nervous system, the immune system, the neurologic system, and what are the implications of how stress functions in the body on their athletic performance and their health. So once they understood, they were given a basic education regarding stress. They were then trained in stress management skills. These are very much like health coaching skills. Relaxation strategies, diaphragmatic breathing exercise, visual motor behavioral rehearsal, so rehearsing making behavior changes, emotive imagery, which is helpful in pain science education, cognitive restructuring, emotional expression in a verbal or written manner. And so they were encouraged to journal, to talk during these group sessions, the facilitator was holding a mindful and non-judgmental space. And as I said, they could journal as well during and between sessions. The last group session then introduced participants to the use of relapse prevention strategies to keep using these skills well on into their careers. They were rehearsed these strategies daily and were provided with audio tapes for relaxation and mindfulness exercise for performance enhancement. So, in addition to what was done in this study, in my practice, I often recommend maintenance health coaching to help to maintain these effects through the occurrences of stressful times for these athletes. The finding of CBSM-induced reductions in injury and illness among the athletes was consistent to prior research that was published, supporting the effectiveness of similar work to improve athletic performance and facilitate recovery following orthopedic injury. So just this kind of health coaching and education regarding what stress and pain is and what it really means really does help to improve performance and facilitate faster recovery. So it should be a part of all of our practices when we're dealing with athletes in pain. All right, so before we wrap up, let's go through a very specific case study about how I would use this strategy instead of just recommending that, all of my 40-year-old perimenopausal athletes, the tennis players, the 5K and 10K runners, there's even a 40-year-old, I guess, gymnast going to be in the Olympics this year. So women are not stopping their fitness, and we don't want to have them just popping Advil, well into their later years. All right, so this was a patient of mine. She was 40 years old. She was a boot camp athlete, cross-trained with weight training and 3-mile runs. The mother of twin 12-year-old boys and a 10-year-old daughter. She works at a desk as an attorney in the energy industry, approximately 30 hours a week. She has complained of, so her chief complaints when she came to see me in my nutrition practice were 5 out of 10 pain, intermittent, but worsening and becoming more consistent. It was in her right hip and sciatic nerve and all the way down her right lower leg. She would wake up in the morning with joint pain in both of her hands most days. Both of her knees had begun hurting after exercise over the past few months. And she was really starting, we talk about the importance of perspective and optimism. And she was like, it was like, oh, I've just hit 40. And now that I've hit 40, I've got chronic pain and it's just going to get worse. And now I'm getting older and I'm worried about worried about when I'm going to hurt. And I'm starting to fear exercise. I'm just not sure what's healthy for me to do anymore. Maybe I should just take up yoga or swimming or give it up altogether. She was in a very fearful and kind of frustrated place about her age and its potential impact on her ability to be an athlete. So to give you some background, her family history, her mother, who was still alive, had a history of osteoporosis. Her father, who was also still alive, had heart disease and a heart attack in his 50s. She has one sibling with depression. She was born vaginally. She was breastfed. She has a history of chronic allergies as a child and was given multiple antibiotics for ear infections as a child. She played soccer through high school, collegiate club soccer, running, and weight training, throughout her adolescence and childhood. The trigger in this case, why she decided to see me at that time, what triggered her back pain especially, was she had an intense work project and she was sitting at a desk for 50 to 60 hours per week. Normally she works more part-time, but she had a big project. So she did that for about a month. And so she was only exercising intermittently, but she did spend one weekend that month doing like a team outdoor kind of race where they were trail running and hiking, and there were like obstacles and short distance swimming in a lake and camping. It sounds like it was a lot of fun, but it was kind of stuck in the middle of this intense work week, and she hadn't really been training for it, right up to that moment. But this was a woman who was in very good physical shape, so it was fine. So again, we look at her triggers. She seemed to have a good birth experience, was breastfed, but then was on a lot of antibiotics as a child. So that's going to impact her digestive microbiome. She had a lot of allergies as a child. So we start thinking, how upregulated is her immune function? And she had these triggers of her extra work, sitting at a desk for long hours and doing kind of a strenuous athletic event right in the middle of it without really consistent training at the time. She presented eating a quote unquote healthy diet. She did eat vegetables, but she wasn't restricting anything. She had a lot of sugar cravings, especially around her cycle. She did like vegetables, does not like fish, wakes up with coffee, drinks 5 to 7 glasses of wine per week. She says she hadn't slept through the night since the birth of her twins, who are, I think, 12 now. So she says she's always tired upon waking, but she has 1 cup of coffee, gets going, and has decent energy through the day. She has a history of mild to moderate anxiety. She uses wine to self-soothe. She has moderate work and financial stress, but she does have a supportive family, close friends. She exercises regularly, but now is having worsening pain with her exercise and did not exercise as consistently just during that month of intense work. And she has fear now about how to exercise, if being over 40 isn't going to make her have to change her exercise. She has a lot of fear of aging and gaining weight. She reported mild constipation and moderate bloating after meals. So again, when we look at each section, how's her energy? Is she able to eliminate? Does she have too much on her plate in her life? And can she poop? The answer is a little too much on her plate, and she's having mild constipation, right? So look at this. This is a helpful matrix from a macro perspective and a micro perspective. When we look at the Holistic Women's Health Assessment, her perspective was quite optimistic with some fear of aging. So 7 out of 10. Good support network for connection, good support network of family and friends, adequate nutrition and hydration, some pro-inflammatory factors in her nutrition, a lot of sugar, a lot of grains, possible food sensitivities, nutrient deficiencies given her intense exercise and work life, regular strength training through her life. She has good emotional resilience with a strong support network. Her contribution, she would like to be more present with her family. She said she's always feeling like she's running. She's running to work. She's running to their activities. She's driving them around. She's trying to exercise sometimes. She's got household chores to do. She just feels like she's always running. But she does enjoy her work and her kids. She just doesn't feel like she's able to be very present with them. She reports worsening brain fog when it comes to attention and anxiety over the past 6 to 12 months, again, kind of contributing to her fear of aging. Oh, I just turned 40 and everything's falling apart. She said, I wake up tired. I haven't slept through the night since the twins were born, but I have okay energy during the day. So that's her resilience assessment. So we did do some organic acids testing and did find some generalized nutrient deficiencies, B vitamins, amino acids. We talked about, is she getting adequate protein? Is it being absorbed if she's got such issues with her digestion, her microbiome? She also has wasting of glutathione, so low antioxidants, which is going to make it harder for her body to not become excessively oxidative stressed if she's exercising intensely and working intensely and running around and under stress. Also, she showed quite a number of markers of general digestive dysbiosis, so we need to deal with that. Her cortisol levels are up, so she's under some chronic stress. Now, her curve is good. That means she's, her rhythm is not bad, but she's pushing the limits of her body's ability, her endocrine system's ability to buffer the physiologic and emotional stress that she's under. She also showed up on her testing with mild estrogen dominance. So what did we do? Well, let's talk first about the supplementation, although the foundation is even more important, but just to be clear here, I recommended that she take GI Revive, which is essentially a product that has demulcent herbs, glutamine, and zinc to help soothe and heal the intestinal lining. Digestive enzymes with each meal to help support really good breaking down of all of the food that she's eating so it can be well absorbed. GI Microbics, which is an herbal antimicrobial, which you could also use oil of oregano and other similar products 3 times daily with meals. And I also recommended a high-quality multivitamin. In general, you can use high-quality companies like Thorne Research, Designs for Health, Metagenics, Nutrients, and so forth. 3,000 milligrams of vitamin C powder. Remember, she was low in antioxidants. She needed some of the B vitamins, so we've done methylcobalamin. Glutathione is another antioxidant. I like liposomal glutathione, so it's actually absorbed. Carnitine, 500 milligrams per day. That was found to be low on her organic acids testing. Collagen protein to help with some of the specific amino acids that were lacking and to get it better absorbed. And fish oil, because she doesn't like fish. She won't eat fish. She's showing some signs of low omega-3 fatty acids, which again will contribute to increased inflammation. And with pain, that is such an important factor. Now, more essential than the supplementation is the big rocks, right? So we have to get her diet right. We need to have her eating an anti-inflammatory diet. I always start with a whole foods elimination diet. She had a blood type of O, so tends to be starting in sort of a paleo-like plan, and that's not always the case. There are various variations in genetics that can be we can start on sort of the right path of exploration when we know the blood type, which gives us some basic information about her genetics. And then we use an elimination diet to personalize her particular anti-inflammatory foods. And we definitely want to be adding some probiotic foods given all the digestive dysbiosis. Talk about a lot about intuitive eating and again, creating that environment of safety, that food is good and nourishing and really helpful. And, again, intuitively, her wine may be okay, but is it really serving her? And is it helping her sleep? And is it the right way for her to de-stress? And so we need to help her to shift that intuitively. And that's where a lot of health coaching skills come in. I also referred her to physical therapy for a structural and soft tissue assessment, recommended that she can consider cross-training to increase some recovery type movement because of her elevated cortisol. Not always such intense exercise of boot camp and strength training and all of that. Mindfulness and breath work. I recommended nature bathing, earthing, which is just literally connection to nature, barefoot or not, being outside, to reduce cortisol levels. Pleasure, self-permission to rest and recovery, looking at her circadian rhythms. And while her cortisol rhythm looked good because it's high, I want to keep an eye on that and make sure she's getting good sleep. Right now, she's getting okay sleep. She hasn't really slept straight through the night. So let's think about, is she being exposed to a lot of blue light before bed, which can impact her melatonin levels. And also a standing desk just to encourage some intermittent movement throughout her workday if she's sitting all day. So what happened was, after 4 weeks, she was consistently on a grain-free, dairy-free, high vegetable, high omega-3 fats. She did agree to eat a little bit of salmon, and protein supplementation, including branched-chain amino acids, an emphasis on fats and anti-inflammatory herbs, spices, vegetables. She eliminated coffee. She reduced wine to 2 to 3 glasses per week and more on the weekends when it was less impactful on her sleep. Dinner outside 4 nights per week to get that nature bathing. Laptop curfew, meaning turn off all the blue lights. Ideally, that would be at 8 p.m., but she was able to stomach 9 p.m., so we did that. She did implement the standing desk. She did restorative exercise, cyclical, in at least 1 session every week. So cyclical meaning in alignment with her menstrual cycle, and that's a whole other topic, which we've done some webinars on, so I won't get into that today. She did not end up going to see the physical therapist, but she did have a full body massage during the month. Her back pain resolved, except for mild 2 out of 10 pain just the day before and the first day of her menstrual cycle. Her hand pain completely resolved, and her bilateral knee pain reduced to 2 to 3 out of 10 after heavy weight training workouts only. So that may continue to improve depending on strength. She may, still benefit from PT for some alignment with how she is doing her heavy strength training, and if it's, her alignment's not ideal. So in conclusion, my whole theory is that as we support female athletes from childhood through pregnancies, through perimenopause, through puberty, all the way through old age, NSAIDs, just kind of quieting the pain when it pops up, is not the answer. We need to listen to the messages of our bodies as women through our whole lives. To get root cause resolution for a female athlete in her 40s experiencing joint pain or chronic pain, we need to have her learn to listen to those messages so she can continue to exercise, reduce her cardiovascular risk, reduce her risk of Alzheimer's and other neurodegenerative diseases, improve her mental health, maintain her bone health, reducing risk of osteoporosis and fracture through her whole life, and support her with a whole health plan. That pain is not to be silenced by NSAIDs. That pain is a yellow light telling her it's time to pay attention and take better care of her physical and emotional needs. If that case and this entire webinar has piqued your interest, you can learn more about our Female Athlete Wellness Program, and this program is specifically for professionals. This program is for physical therapists, clinical nutritionists, health coaches, fitness professionals, athletic trainers, physicians, nurses, any professionals who work with female athletes. The program is 9 online modules that are delivered weekly. It includes a live Q&A call every other month and extended support through our Facebook community. This program is also eligible for CEUs for a variety of professions and a variety of locations. And there is an exam at the end with that. Once you pass that exam, you will receive a certificate of completion. What does this program include? Well, these 9 modules, as I said, they are delivered weekly, just directly to your inbox, but you can go at your own pace. You can take as long as you would like to complete this course. The 9 modules include information on injury prevention and recovery in the young female athlete pelvic and pelvic floor health, optimal nutrition for the young female athlete. We also have to consider things like growth and puberty and brain development in the young female athlete, right? Nutrition for performance enhancement through the lifespan, a couple of modules on the female athlete triad, and now a brand new bonus module fully updated because the female athlete triad is really older data. We now understand this syndrome is much broader than we originally thought when it was named female athlete triad. It's now called relative energy deficiency in sport, RED-S. Herbal medicine to reduce inflammation and promote injury recovery, nutrition for athletic injury recovery, and mindset for athletic injury prevention and recovery through the lifespan. This program doesn't just end with us giving you information. To be sure that you can use this training right away in your particular practice, no matter what your health or wellness certification or license is, this program includes 4 toolkits that are specific to your profession: physical therapy, fitness, nutrition, or health coaching. And everyone who doesn't fall into the other particular categories that has licensure either in nutrition or physical therapy or is a certified fitness professional, you would be able to use the health coach toolkit. Don't worry, if your practice overlaps 2 or more disciplines, you'll have access to all 4 toolkits in your membership site. Each toolkit contains patient handouts, marketing materials, assessment tools, a 6-session wellness program outline, e-cookbooks, and other materials to get you started with creating a female athlete wellness program right away in your practice. This program doesn't just end with us giving you information or even those toolkits, all of that practical information that you can use right away with your clients and to create your own wellness programs. But it's really a long-term connection with you, between you and our institute, because we give you lifetime access to our integrative private Facebook group filled with forward-thinking, multidisciplinary women's health professionals from all over the world. You have ongoing bi-monthly calls with your faculty, usually when a course ends, it ends, right? But with this program, you have access to the teachers and your colleagues for years into the future when challenges come up as you use this material in your practice. This is like a long-term membership program that you only pay for once and continue to reap the benefits for years to come. So who are the faculty? Well, let me introduce you to Dr. Julie Granger. She's a physical therapist and she's board certified in sports specialties. She's a board certified sports specialist physical therapist, right? Sorry, say that 5 times fast. She has clinical expertise in working with young female athletes. She's a former Duke University Division I swimmer, Pilates instructor. Julie knows this and lives it, which I love. I think your best clinical educators are those who have had not only clinical experience, but personal experience. Michelle Lyons has depths and depths of experience. She's a global women's health expert, physical therapist. She has taught in Australia, all over Europe, the Middle East, all over the United States, Canada. She is sought after everywhere. She's based in Ireland. She is also an herbalist. She educates physical therapists, fitness professionals, herbalists, and health coaches all over the world on perimenopausal and pelvic health. And I am Jessica Drummond. As you know, I'm a global integrative women's health expert, physical therapist, clinical nutritionist, and health coach. I teach internationally to professionals working with female athletes through the lifespan, women with chronic pelvic pain and chronic fatigue, and women with fertility and postpartum recovery challenges. So what can you do with this training? Well, our past graduates have used this training and the toolkit materials to expand their current wellness services. Some have added brand new revenue streams to their practices and have connected with new segments of their community. So for example, one of my past students was working primarily with pelvic pain, which is a great subspecialty, but it can be very demanding and draining. It is a challenge to overcome pelvic pain, both for the patient and the professional. Whereas working with athletes who are often quite motivated can be a little more rewarding, fun. It's all rewarding and fun, but it's nice to have some variety. So that was wonderful. And a lot of fitness professionals take this course to have just a leading edge depth of understanding regarding the clients that they're working with in case they get injured, which they often do. The cost of this program is $1,297 for the complete package, which includes all of the training modules, lifetime access, the private support community, live calls, and all 4 bonus toolkits. So thank you for joining me for the webinar today. We covered why NSAIDs are so damaging to the health of female athletes, how to screen your female athlete clients for resilience, evidence-based and cutting-edge functional nutrition strategies to reduce pain in active women, how to use health coaching to augment pain science education specifically for active women. Take today's training and apply it right away in your practice. The female athletes in your community will thank you. Thank you for joining me for the webinar today. And if you want to go deeper with this material, work with more motivated active clients, and have support for years along the way, I invite you to join us in the Female Athlete Wellness Program today. For a limited time, you have the opportunity to join us at more than 50% off the regular price. See all the details below this video. I'm offering this program for a very limited time for just $647. As soon as you register, you'll receive immediate access to your materials and an invitation to our private Facebook group. You'll also have access to our amazing support team, they really are amazing, who are there for any tech support or other questions. We're very experienced with technical newbies. You will not be overwhelmed, and if you are, we are here to support you. It was my pleasure to share this important information with you today. I look forward to getting to know you better and to support you to grow your practice, helping more women to achieve their sports and fitness goals and to healthfully stay active all throughout their lives. For more information about this program, you can read on below. Thanks so much for joining me. I would love to meet you inside of the Female Athlete Wellness Program. Act quickly and you can join us at more than 50% off the regular price. Take care. Have a wonderful day. Bye-bye.